What if I were to tell you that the United States is the only developed country where average life expectancy is declining, and that unhealthy lifestyles are a significant contributor to this troubling trend? Hi, my name is Vanessa Paquette. My background is in critical care nursing, and I am currently a nurse practitioner student in Fort Dodge, Iowa. I welcome you to In Our Care podcast, where we delve into how prevention, not just treatment, will be the key to mitigating how chronic diseases are wreaking absolute havoc on our healthcare system, causing costs to skyrocket through the roof. On this episode, we will be discussing rising healthcare costs, including prescription drug pricing, why the current healthcare system is not set up for the prevention of chronic diseases, what Congress is doing about it, and how nurse practitioners are taking over primary care, and with good reason. So first things first, the economic burden of the American healthcare system is multifaceted and affects personal finances as well as broader economic stability. Today, healthcare spending in the US is up to $4.5 trillion, yet Americans are unhealthier than ever. Not only are Americans getting sicker, but the Medicare Hospital Insurance Trust Fund only has enough funding to pay full benefits to beneficiaries, which is approximately 40% of the population, until 2036. Something is not right here, and things need to change. If you are wondering why your doctor is quick to write you a prescription but spends little to no time talking to you about what you should be eating, it's because on average, medical schools in the US only include about 21 hours of nutrition education over the 4 years of medical school. And the word nutrition is not even included on any board certification exam. Even if they wanted to, they would have no idea how to construct a treatment plan where prevention interventions can be the standard of care. This is going to require a complete overhaul of the current medical education system and will require the participation of our legislative and policy leaders on a local and national level. 74% of adults in the US are overweight, including 43% who are considered obese. Most troubling, the increase of childhood obesity has tripled since the 1970s, and more young children are being put on prescription drug medication. As a mother, that is not something I want my kids to go through if I can help it. Now, one congressman seems to be catching on. Vern Buchanan, who represents Florida's 16th district, is the chairman and most senior Republican on the powerful U.S. Health Subcommittee, which has broad jurisdiction over Medicare. Buchanan has recently launched a bipartisan initiative called the Congressional Preventative Health and Wellness Caucus. The goal of the caucus is to bring awareness to the crippling obesity epidemic in the country in hopes of advancing policy-centric solutions that focus on prevention, medical research and innovation, food as medicine, and exercise. Although the topic for another podcast, Congressman Vern Buchanan has also pointed out how obesity and chronic illness have had detrimental effects on military readiness, with the majority of potential military recruits being turned away due to physical unfitness for one reason or another. He goes on to say that this is an issue of national security on top of everything else. What is it going to take? Right now, there is a physician shortage due to lack of interest and lack of incentive to enter primary care. Doctors are being incentivized to treat when they need to be incentivized to early prevention interventions. Well, I think that's a perfect segue into talking about nurse practitioners, why we are in such high demand, and why we are particularly qualified to fill the primary care provider shortage. First, let's talk about training. Nurse practitioners undergo extensive training, often holding master's or doctoral degrees. This advanced training equips us with the skills to provide high-quality care across a wide range of health issues. One of the standout qualities of nurse practitioners is our patient-centered approach. This is a major difference between the nursing model and the medical model. We take the time to build strong relationships with our patients, leading to higher satisfaction and better health outcomes. We emphasize communication and education, empowering patients to take charge of their health. These are things we have done for years at the bedside and are ingrained in us. Okay, as we wrap up today's discussion on rising healthcare costs and the vital role of preventative medicine, it's clear that we face significant challenges in our healthcare system. Nurse practitioners are uniquely positioned to lead the charge in this area, providing accessible care that not only addresses immediate health concerns, but also emphasizes prevention and education. By prioritizing preventative measures, we can reduce long-term costs and improve overall health outcomes. Investing in preventative care isn't just a smart financial decision, it's a moral imperative. As healthcare providers, we must advocate for policies that support this approach and empower patients to take charge of their health. Thank you for joining us today. If you found this discussion valuable, please share it with your network and consider subscribing for more insights on healthcare innovation and the crucial role of nurse practitioners. Until next time, let's continue to champion a healthier future for all.